Welcome to our lesson on understanding health insurance cards. Health insurance cards are proof of a patient's insurance policy and are critical for verifying coverage, ensuring accurate billing, and facilitating smooth check-ins. Typically, these cards include the patient's name, member ID, date of birth, insurance name, group number, and payer ID. Let's look at a sample Anthem insurance card. Notice the member ID prominently displayed at the top. This number uniquely identifies the patient within the insurance company's system. Below that, you can see the group number, which often represents an employer or a network. Notice the bottom right corner, where the suitcase icon is located. This icon indicates whether the plan includes out-of-state coverage, also known as a blue card. If this icon is blank, additional verification might be required to confirm the patient's coverage. Also note this area at the bottom, which specifies the type of Anthem plan. The type of Anthem plan helps determine network eligibility. For example, if the plan type isn't marked as PPO, further investigation may be needed to ensure your clinic participates in the network. Next, let's look at a sample Cigna card. Notice the phrase "No PCP required" printed on the card. This means the plan does not require a primary care provider referral for specialist visits. Now, look at the health plan number displayed toward the center of the card. Be careful here. This number is different from the group number and should not be entered as such in the system. Below it, you'll find specialist copay amounts, which can vary significantly from primary care copays. Be sure to check and document these details accurately. Now let's look at a traditional red, white, and blue Medicare card. Notice the Medicare Beneficiary Identifier, also known as MBI, here in the center. This is a unique number for each patient. The start dates for Part A and Part B coverage are listed below. If Part B is missing, it likely means the patient has other commercial insurance for office visits, so you would need to be sure to ask the patient about additional or secondary insurance coverage. Now for comparison, let's look at a Medicare Advantage card. Notice the RX indicator we see here. This signifies prescription coverage under the plan. Directly below, you'll see the phrase "referral required." This indicates that the patient's PCP must provide an authorization for specialist visits. As discussed elsewhere in the course, missing this step could mean the clinic won't be reimbursed, should appropriate referral not be received prior to the visit. Now, let's take a look at the Railroad type of Medicare cards. Depending on where your practice is located, you may not see these very often. But understanding the difference is crucial, since their claims are processed differently than those for traditional Medicare. At first glance, this card looks nearly identical to a traditional Medicare card. However, there is a key difference. At the bottom of the card, you'll notice a small but important